I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. Cancer can be a devastating diagnosis, but there's hope on the horizon in treating this disease. Catholic Health Services of Long Island is committed to providing the very best care for its cancer patients and helping to alleviate any fears. To speak more about Catholic Health Services cancer care is Dr. Bhumi Mehrotra and Dr. Natalia Critchmore. Please stay tuned to today's episode of CHS Presents Health Connect.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay. Just go to the site.
Welcome back to CHS Presents Health Connect. Joining us now is Dr. Bhumi Mehrotra, Director of Oncology and Director of the Cancer Institute, St. Francis Hospital, the Heart Center, and Chief of the Oncology Service Line for Catholic Health Services. Dr. Mehrotra is a recognized expert in cancer care and the latest treatments for patients. Thank you for being with us, Dr.
Thank you
Mehrotra.
for having me.
Well, you know, you've been on the show so much. I was joking backstage that I think you should host the show, but it's really indicative of how much our cancer service line and cancer services have grown at CHS under your leadership.
It's really been an amazing journey. Over the last 5 years, we've seen a tremendous amount of effort and energy in enhancing our ability to reach out to the needs of our community. We are really blessed, Patrick, that we have so many friends, neighbors, relatives who trust their care in our hands and unfortunately have been given the diagnosis of cancer. What I have personally seen is that over the last few years, we have significantly enhanced our abilities to give them quality, compassionate care right here in their neighborhoods and give them all the expertise that is required, not just in the medical way of wonderful surgical skills, medical skills, radiation therapy skills, but also now what is critically important to raise the health, well-being of our community is enhancing the screening efforts so that we detect cancer earlier, the curability is higher, and then, God forbid, there is the diagnosis of cancer. We have come together as a group of, really a family of institutions spanning from the west to the east of Long Island to provide coordinated, excellent care in the typical compassionate fashion that Catholic Health Services is known for. That combination is very unique. The biggest challenge for any individual or their family once they have had the diagnosis is how to navigate that journey. And I think we have raised the bar. Our navigators, whether it is through the surgical services, the medical services, the ancillary services, psychosocial services, and as you mentioned earlier, palliative care services, are truly navigating our community members through this journey. An important challenge that arises is after the definitive treatment of cancer is over, how do we integrate those individuals back into the mainstream of life?
Yes.
And that is something called survivorship.
Yes.
We are doing, I think, a much better job now than we were even thinking about this issue 10 years ago. Because fortunately, we are in the situation where many more individuals are either being cured of their cancers,
Yes.
or they are now living longer with cancer. This is clearly a change in paradigm than when I went into training about 30 years ago,
Yes.
where the diagnosis had very different
Oh,
implications.
no question. So let's talk about that. I mean, 5 years ago, really you were involved in instrumental in leading development of our cancer center at 2200 Northern Boulevard. What's changed now? What's some of the new developments that you can share with the viewers in terms of the cancer service line and new services being offered?
So I think one of the major efforts has been to bring the different disciplines together so that we are all communicating live in real time for providing comprehensive care for an individual. We have at least 10 different multidisciplinary groups spanning from neuroservices, neuro-oncology services, to breast cancer services, thoracic, that's lung cancer,
Yes.
gynecological oncology, gastrointestinal, and many more, where there are specialized group of physicians along with their support staff, pathologists, radiologists, sitting together every week or every other week, reviewing complicated situations and providing their intellectual opinion as to what is the best next step. I think we have clearly made tremendous advances in coming together, collaborating to provide that kind of really state-of-the-art care.
There's no question. Yeah.
The second thing I believe, as a family of institutions across Long Island, the electronic health records that we share on the same platform allows us to collaborate with our colleagues at all the institutions. And we may have an individual who's being cared for at one institution, but unfortunately ends up in the emergency room at another institution. We share the records. We are all part of the same family.
Yes.
We have great collegiality, and we have expertise in many of these institutions that we can provide the best care right there. That, I believe, has been a tremendous advance.
I was going to say there's no question because I see it in the care and how it's delivered, that comprehensive care spanning medical oncology, surgical oncology, survivorship. Still, so many of our viewers, though, feel if they do get that horrible diagnosis that their only option is to go into the city.
Yeah.
What would you say to our viewers about that?
So the first thing I would say, Patrick, is there is no one more vested in the care of our community than us, who are part of the community.
Yes.
We are honest, transparent, and we provide them, I would say, the finest care in over 90% of the medical situations. If we feel there is a particular talent that we do not have, we are one of them, and we are honest enough to say, well, for this particular rare entity or for this very super specialized need, this institution in this part of the country may be the most ideal. We are on their side, and we agree. But for the large majority, I would say for over 90% of cancer-related treatments, they are typically given in our own community.
Right.
And I'm really proud in saying that we have some of the best talent
Yes.
and the most genuine hearts
Yes.
in our family of medical community. And this goes right from the person who greets the individual to cares for them, the nursing staff, our pharmacy colleagues, our physician extenders, our physicians. They all have just one goal: the highest standards of medical care in the most compassionate way as we would like to be treated.
That's right.
And we are there to provide the best care. And if for some reason we are unable to give that very tiny percentage of people the care that they need, we will make the appropriate referral for their best needs.
You know, one other point that I wanted to make sure that the viewers at home recognize, and this is very different now for cancer care than perhaps when our parents went down this journey, which was when they got the diagnosis, they actually would think this is a death sentence for me.
Yeah, absolutely.
And today, the treatments that are available. Can you just quickly share for the viewers at home some of the new advances in chemotherapeutics and immunomodulators, the new types of treatments that you're seeing such incredible success for your patients with?
I would say the last 10 years, and particularly the last 5 years, has changed the landscape of what we do in oncology. The first is we have stopped working in silos. We work as a team. Surgeons, medical oncologists, radiation oncologists, pathologists, the unsung heroes of our field, because they are now instrumental in identifying the genes in the tumors that allow us to predict and prognosticate how a treatment will work. Our radiologists, who are getting smarter by the minute with their technologies, whether it is with really specialized PET scans or specialized MRI scans, looking at the functional aspects of tumors. So the multidisciplinary way has enhanced the collaboration. But what has led the field forward significantly is us understanding the genetics, the DNA of the
genetics
tumors,
of cancer,
and being able to personalize that for an individual's care. It's no longer one size fits all. Very different from many years ago. There are targeted therapies that have changed the lives of many individuals, even when the cancer cells have traveled to sites away from their site of origin. And then we have this new field, as you mentioned, about immunotherapy. Now, cancer cells are very smart. As much as our immune system is driven to attack any foreign cell, may it be an infection, may it be a cancer cell, after a while, these cancer cells camouflage themselves from the immune system. So the immune system becomes tolerant. They don't recognize these cancer cells. What the newer therapies are doing, Patrick, are they, number one, lifting that camouflage. So now the tumor cell becomes exposed to the body's immune system. And number two, stimulating the body's immune system to now fight that cancer cell that is exposed. And this is across all various tumor types. And every week we're learning more. I would say my practice in oncology has changed dramatically in the last 3 years, where irrespective of the site of origin of the tumor, we used to say, lung cancer needs to be treated this way, gastrointestinal cancer needs to be treated this way, breast cancer needs to be treated this way. But now we are learning if there are genetic markers that are common, that for which we have a target, they don't have to be treated based on their tissue of origin, but they really have to be treated based on the molecular markers.
It's really amazing. It's targeted, specific therapy.
Right.
Well, Dr. Mehrotra, the cancer cells may be smart, but you and your entire team are far smarter. And I can't thank you enough for the quality of care that you provide for our patients. And I want to thank you for joining us today on our show.
Thank you very much. Thanks for having me.
You bet. When we get back, we'll discuss the Cancer Center at St. Joseph Hospital. Please stay tuned to CHS Presents Health Connect.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to CHS Presents Health Connect. We are now joined by Dr. Natalia Kritchmore, Chief of Hematology and Oncology at St. Joseph Hospital.
Hi.
Welcome.
Thank you.
Well, it's great to have you here.
Thank you so much for having me here.
Well, tell us a little bit about the CHS Cancer Center at St. Joseph Hospital. You know, I had the distinct pleasure of touring the facility after it was just finished being built. It really is a beautiful state-of-the-art facility.
Absolutely. It's state-of-the-art facility. It has great patient stations. They are private. We can provide care for patients in this private, safe environment. And it's not convenient just for the patients, but for the family members too. They can stay with the patient. They can leave and wait for the patient in waiting area. And of course, it's a great unit because it's located right in the middle of community.
Yes.
So now patients don't have to travel miles to obtain their chemotherapy care or other infusions or transfusions. We offer a variety of services, and that could be done close to their home.
And that's really important, right? Because, you know, Dr. Mehrotra and I were speaking this before, and as you know, being an oncologist, cancer care has changed so much, but it's really chronic disease management. So a lot of times for an acute intervention and chronic disease management, it's the frequency of treatment. So you really want these services to be close to home for families so that they could come in, get those treatments, and then go back to their activities of daily life.
Yes, and that's very important for patients. We can provide all the services that patients used to go, let's say, to the city to obtain certain infusions or treatments. We can provide them closer to their home.
So we could do it right here.
So they can do it right here. They can have more time to spend with their family.
Yes.
They, in a lot of cases, these patients don't feel so good to travel miles to receive chemotherapy or to receive transfusions. So that makes it much easier for patients to live with cancer.
Yes.
Because nowadays, cancer is a chronic condition.
Correct. Correct.
We can treat it for years. There are multiple new treatments coming every month. And that's what helps patients to live with it and live longer.
So that's really a good segue into, maybe you could share a little bit with the viewers for the St. Joseph's Cancer Center. What types of infusions and chemotherapies does the center offer?
We offer all range of chemotherapy. We offer other treatments like immunotherapy. We can provide different infusions, not for cancer patients, but let's say for patients who are treated for arthritis-related conditions, immunotherapy infusions, intravenous gamma globulin infusion. We can provide transfusion for patients who require chronic transfusions.
So given all of those different types of modalities available, I'm assuming the staff must be specially trained to be able to manage this care.
Yes, we have highly trained. The nurses are all certified in administering chemotherapy and other immunotherapies, in administering transfusion. We have full staffed unit with 2 nurse practitioners on site for the whole day. And they are experienced in chemotherapy treatment and in other infusions.
So really important. You have the whole team there, between highly trained, well-qualified physicians to the nursing care, support staff. It's all there in one unit that really offers patients the best quality of care and a comfortable private environment.
Yes, and the hours are very convenient. The unit is open 6 days a week.
6 days a week?
6 days a week. So in a lot of cases, when patients depend on the family members to bring them in, the patient can get treatment on Saturday, or transfusion could be done on Saturday. The unit is open 12 hours a day from 7 a.m. until 7 p.m. So patient can receive treatment at different time of the day, whatever suits the need of the patient. And again, it's very conveniently located right in the middle of community.
Yes, I know. How would patients access the center?
It's very easily. We have a large parking lot. The unit located really close to the entrance, and the wheelchair access available, so we can always help family members to bring the patient in with wheelchair.
Yeah, and I think one of the things that we wanted to do at CHS is recognize that St. Joseph's Hospital, again, one of our excellent hospital facilities, is conveniently located right in Bethpage on Hempstead Turnpike,
Right.
really in the center of the island.
Yes.
So as cancer care and our cancer service line is growing, we're trying to, again, further differentiate where these services are being delivered
Right.
in different settings closer to the communities in which we serve.
Yes.
Yeah, so it's very exciting. Any other features about this center that you'd like to share with the viewers at home?
Actually, we have extra services available.
do?
Yes, we have a nutritionist who can provide consult to patients. And in a lot of cases, even so, patients kind of know what they need in terms of helping them to recover and feel stronger. The nutritional consult is very helpful. We have social worker available for consultation and for help. And again, patients undergoing chronic treatment for cancer in a lot of cases require extra help.
Yes.
And the social worker on site is very helpful.
So that's great. It's not just the best clinical care, but you have the ancillary support services. And of course, our mission, our vision, Catholic Health Services, we also have spiritual help.
Yes.
So it encompasses the full spectrum of healing, if you will, for our
Yes.
patients. So that's wonderful. Dr. Critchmore, I'd like to thank you very
Thank
much
you.
for joining us today. We'll be right back for my final thoughts and my health tips and solutions of the day. Please stay tuned. And now, my final thoughts on our discussion today, which we were discussing cancer care. Care for cancer has changed so much over the last 10 years and even more so in the last 5 years. It is no longer a death sentence. You need to know where to get the proper treatment. At Catholic Health Services of Long Island, we're very proud of the cancer services that we offer across our system, and I encourage all of our viewers to work with your primary care providers to do the proper preventive screening tests. Man or woman, your annual wellness exam, your mammography, your gynecologic visit, for those of appropriate age, colonoscopy. All of these types of preventive tests can help catch cancer at its earliest stages, which gives you the best chance for cure. But even if, God forbid, you develop cancer or find cancer in a later stage, with all of the new treatments that are out there and available, it really is managing a chronic disease. And people are going into remission, living longer lives with far better quality of life. So see your doctor, ask the appropriate questions, get the preventative testing done that you need. And now for my health tip and solution of the day. Today, we will discuss important information about smoking cessation. My goal is to bring you information that will help you live a healthier life. With so many experts out there, it's hard to know what is factual and what is not. I'd therefore like to share with you truth in medicine, with no spin, no marketing, just the simple, unvarnished truth, as well as some trusted sites for information you can reference from home. I hope you will find this information beneficial, and I wish you a healthier, happier life. Today, we will be discussing the risks of smoking and smoking cessation. Smoking is still the #1 public health problem, responsible for more disease than any other entity. As with all of my tips, I'd like to offer one great source of truth. And this one is from the American Cancer Society at www.cancer.org. Go to this site and search Quit Smoking. There you will find material about the risks of smoking, a Quit for Life overview, and tips and treatments for overcoming tobacco addiction. And it is an addiction. The American Cancer Society states that smoking cigarettes kills more Americans than alcohol, car accidents, HIV, guns, and illegal drugs combined. Smoking doesn't just cause cancer, it can damage nearly every organ in the body. Now, in the medical profession, we often hear, "Doc, don't tell me why I should quit, tell me how I can." The first step is deciding to stop smoking. Without a sincere commitment, no option will be successful. Start with a plan. Outline why you want to quit, when and how. Make sure you have a support system in place. The American Cancer Society's website details the steps to quit and offers choices from nicotine replacement and prescription medication to going cold turkey. You can also try filters, smoking deterrents to curb nicotine cravings, e-cigarettes, and even acupuncture, to name just a few alternatives. Don't forget to address the mental aspect of tobacco addiction. Common withdrawal symptoms include anger, anxiety, sadness, trouble concentrating, and a sense of loss. All 50 states and the District of Columbia offer some form of telephone-based program that links callers with trained counselors. People using telephone counseling have a greater success rate than those who don't. Many Catholic Health Services facilities offer free smoking cessation classes. Remember, it's never too late to stop smoking. The benefits include lower blood pressure, increased circulation and lung function, reduced coughing, and less shortness of breath. Quitting will cut your risk of lung and other cancers and reduce your chances of coronary heart disease. Help your body help itself. Food will taste better, your sense of smell will increase, and your teeth and fingernails will also stop yellowing. You can find all of these tips and more at the American Cancer Association's website, again, at www.cancer.org. That's my tip for today. For more health information, watch CHS Presents Health Connect, airing on Telecare and CBS TV 55. To view recent episodes, go to CHS's YouTube channel. If you'd like to know more about CHS Cancer Center at St. Joseph Hospital, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.